I am so excited and humbled to have been asked to moderate this critical conversation. So this roundtable brings together a formidable panel working at various levels in the health sector, at the global, regional, national, and local levels. And you are also experts in health and/or gender equality in your own right. So we're looking forward to hearing from you too in the second half of the event.
We're not meeting any targets. We're not doing very well at all. If anything, recent events and the focus on the pandemic has taken us backwards.
Our policies need to be updated. Our policies really have to reflect what the statistics are saying to us in terms of our young people and their needs.
The primary issue here remains an underinvestment by governments in the health sector.
There was a feedback that the pandemic has shown us the disparities between the rich and poor, but I think it's not just rich and poor, it's the gender, men, women, trans people, communities, LGBTQ populations. This is not black and white, it's a spectrum. We have to think from that angle.
As we continue to increase access to care, how do we make sure there's a critical balance between being able to pay for these commodities and really making sure that people receive the services that they need at the point of care?
Access to health, which is a human right, is not a business for health ministries, health ministers. It's the business for government. And we start by looking at those wider determinants: education, access to clean water, those basics. Then we can start to talk about healthcare, the role of the healthcare system. If we didn't learn anything else from COVID, we needed to recognize that when there was no health, nothing else happened.
Health should not be seen as an expense, but an investment. It is just so critical to this conversation.
To improve the health of the population and build healthy societies, there is a need to shift the focus from illness to health. We're not involving the communities. We're not involving those for whom the services are intended. What are their views? How do they see it? What are their real needs?
So just to summarize, I think men and women living with NCDs have a variety of different sort of emotional, practical, domestic, professional, and biological needs that have historically been unaddressed and need to be considered when we're developing NCD policies and strategies around universal healthcare.
When you talk about universal healthcare, one of the first things we need to remember where women with disabilities are concerned is that they might not be able to get to a hospital.
It is key that we realize that health is a fundamental human right, and violence against women is a public health concern and a human rights issue.
And there are very practical things that we can do. We can have the policy, but as CSOs, we can also develop programs and interventions to address a lot of these issues and also fill the gaps that exist.
We're going to move now to our third section, where we actually work now on developing our key asks that we want to put before the Commonwealth health ministers at their meeting coming up on May 20th. So now we want to hear from you, and we have been capturing your comments on what health ministers should put on the policy agenda regarding universal health coverage.
I think it's really important to say it needs to be meaningful consultation.
I think it's to create a sustained mechanism that exists as part of the overall structure.
And how do we integrate the existing health systems so that we are able to provide a holistic response of services?
Great, thank you so much. I think we're adding that at the bottom.
We have to invest more, invest better. I think that is going to be very crucial because our government's current investment commitments and public spending for health are inadequate for us to achieve universal health coverage.
Women have been consulted to death. We are always the first people to respond to surveys. We contribute, and then somewhere along the line, the decision-making process, our views get left behind because we are not in the decision-making space. So my proposal is that we actually need to be intentional about representation of women in decision-making spaces.
And so we just need to build into policy and policy implementation and UHC implementation empathy, from across the board, from everybody working in healthcare.
My key ask was actually around the health financing reforms that countries are going through, that these are context-specific reforms, especially in the context of sustaining that investment. Let it be sustained, and even if it means starting small.
But I'd like to see that we review and reform the national policies to make them more relevant to the health of women, children, and adolescents with a focus on addressing health inequities, including sexual and reproductive health affecting these particular groups.
Looking at health financing with a gendered lens, I think that's really important.
I wanted to say that every woman should have the right to live in a community with the support that she requires, not forced upon her.
It's just when we come together as the Commonwealth that the health rights of older people get left out, and we need to see a change.
I would like to advocate for us to look at ensuring that we now focus on non-traditional approaches to health education and health promotion.
I think the Commonwealth has to adopt a human rights-based approach in order to ensure that all policies relevant to the health response respect, protect, and fulfill human rights, ensuring that key and other vulnerable populations are empowered to claim their right.
We need to invest in training our own local people as doctors, especially women. The people who work in the medical profession need to be reflective of the people in the communities that they're serving.
Thank you so much. Thank you very much for everyone who gave their comments in the chat and Q&A, who came in and gave vocal additions to this as well. We're going to be working on this as we continue to lead up towards that meeting in May.